Good morning, everybody. My name is Dr. Aaron Robinson, Aaron Robinson. I'm the Assistant Medical Director at Hennepin EMS, and I'm also an emergency physician at Hennepin Healthcare. Yesterday was an incredibly tragic day. The medical directors were paged out a couple minutes after this had happened, and part of our job is to relay information and be a liaison between the hospital systems and the providers on scene. The earlier you activate a mass casualty incident, the better. We can mobilize resources faster, and we can get the folks and the equipment there that are needed to help best care for our most critical trauma patients. When I was en route, I contacted EMS Command, and they had information from police that were going to be upwards of 20 victims or more. With that information and the resources that I knew that Hennepin Healthcare had provided, I activated the MCI within a couple of minutes after knowing that, just to get resources mobilized and to get the folks there that needed to be in the upstaff our emergency department for patients to be received. In trauma, when you're talking about caring for a trauma patient in the pre-hospital setting out in the field, minutes and seconds matter. And our job in the pre-hospital setting is to perform life-saving interventions like stopping the bleeding or helping somebody breathe. But every minute that a trauma patient spends on scene increases their chance of not having a good outcome and possibly dying. So I have a huge credit to the Minneapolis Police Department and the other first responders that entered the scene and secured it quickly. The scene was safe in a few minutes after the initial incident, and I credit our brave first responders for doing that. That allowed us to get the patients in and to get them to definitive care very, very quickly. Those swift actions undoubtedly saved the lives of many of those children.